Thanks everyone for joining us for another edition of the Chapters Health System Q&A. Our guest again this week is a familiar face, Dr. Stewart Stein, the Vice President of Medical Services here at Chapters Health System. Thank you so much for joining us today, Dr. Stein.
Thank you.
The subject we want to touch on today involves Alzheimer's disease. June is Alzheimer's and Brain Awareness Month, and many people know it's a very serious form of dementia, but what exactly makes Alzheimer's disease just so devastating?
Well, Alzheimer's disease is particularly devastating because people, it's so gradual, and it's like losing somebody very close to you over a long, long period of time. It can take years to run its course. In the beginning, it typically manifests most commonly with some memory issues. And of course, I'm not talking about, I forgot where I put the car keys. It's usually more serious things than that. And initially, typically people try to make excuses for it or fill in the blanks with made up information. But eventually it becomes harder and harder to do. And as the disease progresses, it turns from more of an inconvenience into something that's actually affecting daily living. The first functions that people lose are the higher functions, such as balancing a checkbook, or maybe driving a vehicle, or certainly going to work. Then later, as the disease progresses, there's more frank disorientation. There might even be hallucinations and agitation. People then oftentimes will begin to lose their ability to speak or to put words together meaningfully. Then after that, lose their ability to speak at all. After that, they lose their ability to walk or even to sit up without some type of support. The reason for that is because the brain is no longer able to tell the feet what they need to do in order to walk. So it's just this gradual progression. It's like losing somebody over a long period of time, very, very slowly, and helpless to do anything about it.
You've been with Chapters nearly a decade now. How have you seen what we know about Alzheimer's disease evolve in that time?
Well, I think we've got a greater understanding of what it is that causes the brain to malfunction. We have known for some time, actually, that people with Alzheimer's disease have these tangles that develop in the brain tissue, these tangles and plaques, and they interfere with the brain's ability to function normally, and brain cells start to die off. But we've, I think, gotten closer in terms of understanding what it is that causes that. We have, I think, developed a greater appreciation of some of the stress that this disease places on families, and we've recognized over time that part of our role is to support the family, help them to know what's coming and how best to cope with it, what the options are. We haven't had a breakthrough at this point in terms of treatment, but we are we certainly have more options now for treatment than we've had in the past, and better ones. There were times in the past when people with this would actually be restrained, and you don't see that anymore. It's a kinder era now.
You mentioned that there unfortunately hasn't been a breakthrough as far as a cure goes, but we do have treatment options. What are some of those?
Well, there's actually several categories of medications that we use, first is probably the one that you hear the most about, the major tranquilizers, or also these are called antipsychotics. And drugs in this category have names like Haldol, Risperidol, Seroquel. And what these drugs do is they help somebody to become less confused and less agitated. They might help to suppress any hallucinations someone might be having. We also have the benzodiazepines. Again, these are not new drugs, but they help with the anxiety component that people experience. There's another category called mood stabilizers. And then, of course, we also have antidepressants, because people with dementia can certainly become depressed, especially if they're aware that it's happening to them. But also because antidepressants have other positive effects, such as improving appetite, a reversal effect on weight gain, weight loss sometimes. The category of drugs that really addresses the underlying pathology are the family of drugs that are developed specifically for dementia. These would include most commonly the cholinesterase inhibitors. And these are drugs that work by increasing the amount of acetylcholine in the brain, which is one of these chemicals that helps brain cells to function better. Drugs in this category there are three. There is donepezil or Aricept, and then there's Razidine, and then there's Exelon. They typically will cause people to have some reversal initially in their symptoms. People will have oftentimes an improvement in their motivation and their orientation. Unfortunately, the effects are time limited. They only tend to last about 6 months to a year. And then people plateau and generally the downhill course continues. So it's not a cure, but it is effective. And it was really, I think, the first class of drugs that truly affected the course of Alzheimer's disease. And we now have Namenda or Memantine as well, which is used later in the course of the disease. And that stabilizes another neurotransmitter in the brain and helps the brain cells that remain to actually function a little bit better. So that's the state of the art now, but there are new things on the horizon.
All right, and speaking of on the horizon, I know Chapters has a new dementia program in the works. What can you tell us about that?
The new dementia program, actually, it is in development. It is something we're going to probably be piloting in the fall. And it primarily educates, helps people to understand what the disease process is like, what to expect, and how to cope as the disease process proceeds in their loved one. Also, it's intended to provide support, put people in touch with our resources and other community resources. And again, we hope to have that go live in the fall. But again, in addition to that, there are other things that we're looking at in the future. As I'm sure you're aware, there's an awful lot of research that's being done about dementia. Dementia is, believe it or not, the 6th leading cause of death in the United States. So this is not rare. It's not a normal part of aging, but it's common. And so it would have a huge impact on our healthcare system and on most of us who probably at some time or another know somebody affected by this illness, if we could actually prevent it or reverse it. And a lot of the research is now directed toward preventing some of these plaques and tangles from developing in the brain. One very exciting area of research currently is that we have a study involving the use of the body's own immunity to prevent the disease from developing or progressing. Monoclonal antibodies are being used, and there's even work being done to develop a vaccine to prevent the development of Alzheimer's disease. So stay tuned. I mean, the bad news is none of it has been demonstrated to be tremendously effective yet. But as you know, we've gotten very good at drug development and new therapy development. We're going to see major breakthroughs in the coming years.
Well, that's fantastic information, Dr. Stein. Certainly good to have a little bit of hope there. And like we said, it is Alzheimer's and Brain Awareness Month. So the best thing we can do right now is just raise awareness about this disease. And, you know, hopefully the research continues and eventually one day we'll find that cure.
Hope so. Thank you.
All right, Dr. Stein, again, thank you so much for joining us. Everyone watching, we'll be sure to fill you guys in with information on that new program when we do launch. Until then, thanks so much, and we'll see you next week.